Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello and welcome back, everybody. Today I have with us guest Angela Nesbitt, who is going to be helping us work on some of those things within our lives that are challenging and how we can do things differently. Welcome. I'll let you introduce yourself.
Okay, thank you, Sarah. Thank you for inviting me. I really am honored. So I started my business because I know what it's like to be a professional in a high pressure environment, and the frustration, stress, and even burnout, when there wasn't even a term for it, what that can do for one, and how there's a choice. Am I going to change the place I'm in, or am I going to leave to have a better lifestyle? And when I look back on that time of transition, I wish I'd had somebody to produce clarity producing conversations so I could have made even better decisions for my career. And after years of doing this work, the feedback I get from senior executives and high performance professionals is that I'm able to create clarity producing conversations for them so that they can make sense of their challenges and complexities, so they can make even better decisions. So what I'm playing for is to help my clients amplify their impact and have a more meaningful life. Yeah.
Perfect.
Okay.
So tell us about you. Where did you start? What was your career?
So I spent a couple of decades as a management consultant in one of the largest management consulting firms in the world, or a few of them. And my clients were literally the largest organizations in the world. And then I did get burnt out, but I didn't know what it was at the time. And then I had this sort of trajectory where I worked as raising my children, and I'd work part-time for boutique firms that were helping clients create high-performance cultures in all sorts of industries, hospitals included. And I noticed that my clients would introduce me to others and say I was their coach. And I was like, I don't know what that is, but I'm certainly not one of those. Fast forward, I decided, yep, people get paid to do this. You get paid to make people look really great. And as I like to say, I discovered my job is to shine the gem. So I want my clients to just absolutely shine. And then I help them create golden chains of trusting relationships so that they can amplify their impact. So I figure, like, I'm building this cosmic necklace of all of these jewels, and people connected.
Beautiful.
So,
Did you start in these in these higher places? Where did we start? What made you want to come into these spaces and work with executives in this executive coaching role? How did you get there?
I think it was a transition from management consulting to working more closely with companies to create high performance cultures, which means that you are really working, well, you're very much working with belief systems, because whatever culture you're in, whether it's your family or your hospital or whatever, there is a culture that says this is how you need to behave to thrive or to succeed here. Maybe not thrive, to succeed. So that just sends me down a path. And so after years of experience as management consultant, but also studying positive psychology and neuroscience, it's just taken me down this path of refining my instincts so that I can be better help to my clients.
Yeah.
Yes, it's one of those things you can look back behind and say, oh, that was my trajectory, but it was always just taking the next step that was presented.
Yeah.
Yeah. And
Tell
a
us
few
some
mistakes.
tell us some examples of things that get in the way of people having a good experience within their workplace. What are some of the things that people come to you with that are not going well for them?
So it depends on the level of trust. So it's very easy for people to put their hands up sort of in public and have some sort of productivity issue.
Mm-hmm.
I'm I'm not being efficient. My staff is not doing this. The cash flow is not working well. I've got wrong people on the team. That's often an easy place to start.
Hmm.
Um, then if there's a little bit more confidence, they might start to talk about this sense of overwhelm and loneliness.
Mm-hmm.
And when there's a deep level of trust, it often has something to do with not thinking that, not really believing in yourself and being an agent of change.
Mm-hmm.
And that's where we start. I mean, that's where the real hard work comes, is helping people connect with themselves, but really starting to connect with their magnificence,
Mm-hmm.
and which then enables them to be able to navigate uncertainty and unpredictability, which doesn't matter where you are in the world, you've got that. But if you're in medicine, you get that in spades.
Yeah.
Um, and um, and then probably the exact first place that I like to start is to help my clients self-identify their unconscious behaviors that are sabotaging them. And I say unconscious because if they knew what they were doing, they would not do it. And these unconscious patterns, more often than not, come from very early in your life, maybe even childhood, and they made you successful. This is what you relied on to be successful. And then you wake up one day and you become conscious that what seemed like a great coping skill
Mm-hmm.
is sabotaging you. And that's the first place that I like to work, because if you don't know that you're sabotaging yourself, it's like walking through life filling a bucket that has holes. And it doesn't matter what I do to help you. Those patterns that are running unconsciously, they're running their racket, is just letting out all the energy and knowledge and effectiveness and everything you have. That's the first place we start. And then we identify those patterns that you have, especially as a leader, because most of the people I work with are in a leadership position. We measure the gap between what you intend to happen and what the effect is. And there might be a bigger or smaller gap, and we look at various measurements of effectiveness as a leader and close those gaps. Once we do that, then we can go in so many directions, and either working with me or even working with other professionals. So I will often come in after, let's say, a management consultant has come in and given you advice on change management or more effectiveness or whatever it is that's technical.
Mm-hmm.
As long as you have these patterns that you and your team are running, you can't implement that change.
Got it. I
Yeah.
see. So when you identify productivity, cash flow, team isn't working well together, there's something within that measurable within the business that's not going well. Like whether it's their personal business or the business at large. The consultants come in and said, you have a problem with team dynamics, you have a problem with cash flow, you have a problem with productivity. And now, this is what you should be doing. Steps towards implementation. And you're saying, but they can't do that because there is other forces personally within the leadership that need to be worked on first. And many of them are in this self-sabotage area.
Yes.
Got it.
So,
Beautiful.
and I will say that if you're trying to make a change that's difficult, it's not a Nike change, it's not just do it change. This is how our mind works. Change causes stress. Stress activates these patterns that sabotage you. And until you learn to close those down, until you learn to deregulate that part of your brain and upregulate the parts of your brain that the cortex area, you're just on shifting sands.
Got it. Okay. And I totally understand where this is coming from, because every time we make change, we have unfamiliar, and we have it's uncomfortable, it's different, it's inefficient because you're not used to it, it's not familiar yet. It brings up all of the things. And when I'm talking to the physicians I work with, we often call it that automatic response. This autopilot of how we deal with change or how we deal with stress, this auto response that we think is the only way because it's what comes up. What are some of the self-sabotaging patterns that you see frequently? What sort of automatic responses or stress responses are you noticing?
So through factor analysis, there are apparently 10 different responses, one of which is common to all of us, and then you have a choice of 9. So I would say within physicians, there is this resistance to change because there could be a risk associated. What if I change the way I communicate in the operating room? Angela's come in and said, well, you're going to be more effective. Or somebody, you, Mary, have come and said something about, oh, you can do your work more effectively. Well, that's a risk I don't want to take. One of the big ones that is physicians, especially in this part of the world, have heavily relied on their, I would say their left brain, got them through school, but the part of their brain that is rarely developed is the part that activates inspiration and motivates people. And so that's unfamiliar territory. There is a big risk that many physicians have of over-focusing on unnecessary details. Now, if you're a neurosurgeon, mistakes are not tolerated. Like tiny, tiny mistakes can't be tolerated. And that's very different from, let's say, somebody in family practice. But it is so easy to over-index. It's all about over-indexing on a strength that now sabotages. Not that it started off badly, or if to get into medical school, you needed to have a lot of drive to get through. But when you over-index on that strength, especially when you're under stress, it disconnects you from other people. You're less able to read the rooms, the subtle unsaid messages. So we all have our combination of patterns that we've developed. And my initial work is to give you the tools to self-identify what your pattern is, and then give you tools to down-regulate them so that you come back into that healthy zone where you can thrive instead of struggling, if that makes sense.
Yes, it does. I think maybe one of the examples is if we're looking to delegate a task to a staff member so that we can increase the time we have to do other tasks within our day. So, for instance, if you have a form, it often has things attached to it like x-ray reports and other kind of specialist reports come in. But if you wanted to give that to a team member, now you're going to be fussing that they got every single thing right. It's going to take you longer. And that obsessive piece or that detailed piece is important because we don't want to miss things. We have to think about all the little pieces of a patient. And so that giving a task to someone else can become so overwhelming that we end up giving up and taking it back ourselves. So we're
Yes,
doing this work that's totally not ours to do because it's expensive, a very expensive secretary at that point.
yes, yeah. When I remember, that was a hard lesson for me to learn as a junior. I think I was fairly junior because I remember my partner coming in and saying, "No, this is too expensive," but I could do it faster than the secretary. No, it's too expensive, and so there might be a resistance and maybe a legitimate feeling like, well, this is risky to hand over. But apart from the expense side is the way you approach this and your tension and fear and anxiety then spreads out to everyone else. And so that person you're delegating to is picking up on this, and you don't have to say anything. I mean, it is being picked up by mirror neurons. So he or she that's taking on this job is now down-regulating their ability to be effective. Plus, you have the fact that in that delegation, initially, there is more work for you to do because you have to teach somebody and to have that patience and not to sabotage the process because of your unresolved anxiety and fear.
Yeah. And so it can feel too difficult to create that change because we keep poking into the wrong place when we're trying to teach and give someone else this task. I think some of this can be like one of the strategies, for instance, would be that quality check. Like before it goes out, bring it back to me and let me have a look at it.
Yes. Yes. Yeah. The there's something I think there is, unless you know as an individual what racket is being played in your head, it's hard to know what tactic or strategy to use to compensate for it. Okay.
Yes.
Because if you're somebody like me who if I'm not conscious, I'm going to avoid conflict. So now I need to go to an overworked whomever and ask them to do this job. Well, I might avoid that conflict. Or I'm also somebody that likes to please. That's great. It makes me very good at what I'm doing. But if I over-index on that, I'm not going to speak up for a change because I don't want to displease whomever on the side.
Yeah.
So we all have our combination. And if let's say I want to avoid conflict, and then you or somebody well-meaning says, well, ask that person to bring it back to you. That's not really addressing my issue. That might be addressing somebody who's really very detail-orientated. And truth be told,
or risk averse. Yeah.
I'm just letting you know, I'm a recovering perfectionist as well. Yes.
Yeah. Yeah. But you're right. The people pleasing part, because you don't want to say to them, you didn't get this right. You'll just take it back over.
Yes. 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 Yeah.
You're trying to keep them happy.
Yeah.
At the expense of you being happy because now you're doing the work again.
Yeah. 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 So it's being able to connect to yourself and what it is that's happening like what you're doing, before you start to try to have an impact on your team or your business, your medical practice or medical team, whatever.
Mm-hmm. So you mentioned about creating relationships like a gold chain. Tell us more about that.
So so we are hardwired to connect as humans. We're hardwired to navigate, and we're hardwired to grow. And if you want to thrive, you need to know how to connect with other people at the most basic level. But if you're trying to amplify your impact and you're trying to do something important, you need other people around you to help you with all of their different skills and their network and their capital and whatever. So that's a skill you have to learn. And the first, and this all happens through conversations. And if you don't have that conversational intelligence, if you don't know how to deliberately create trust, you can have the best intentions. They can have the best intentions, but meanwhile, you're sabotaging that process. So that is another important part of my work, is to help people deliberately develop the skills that create trust. Because that's not something we learn in school.
No. Now, I'm going to say that physicians or people within the healthcare industry overall tend to be trusted, at least by the people that they are seeing. So, for instance, their patients often have high levels of trust, and community have high levels of trust in physicians or clinicians at this high level. Why? What is it that creates trust? Why are we creating trust widely? Or maybe that's not true. Maybe I'm wrong.
Well, I think there's a lot of positional trust. You walk in with a white coat and a stethoscope. Okay, we know who you are.
Yeah.
And so you suddenly got that authority.
Okay.
And there's an incredible wealth of knowledge that physicians have that a patient doesn't have. And if a physician, for those of physicians who have created a lot of trust, they can effectively give a patient a sugar pill, which will often be more effective than many medications, right? I mean, there's data to show that, because with that trust, then the patient starts to, their healing process inside their body is activated. And I will say that for many physicians, they have not learned to build that human trust, that connection at a human level that has nothing to do with their stethoscope. Their ability to empathize, to be curious, to what's the word? Explore, what's more than explore, but to brainstorm with a client on how something could work, to be able to connect to what's really important to a client.
Yeah.
Those are really important skills, because you have a patient who is, let's say, terribly ill in hospital. And, this medical team has all of this ammunition to keep this patient alive, but it's not meeting the client's deepest need, which might be to go home or to be with family or to eat something. That's where trust is created. So then the protocols you would use would be so much more effective, because you've understood the patient more, or you're able to pick up on your colleagues' intuition, or there's something slightly off with your nurse right now,
Mm-hmm.
and to be able to identify, well, that mistake that she made is not because she's careless, but maybe she's overtired or something's going on at home.
Mm-hmm.
Well, instead of exploding or mistrusting her or blah, 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 having that trust allows the two of you to have a conversation and down regulate assumptions that aren't helpful. It's all about down regulating all of these hormones that come out of the survival brain and up regulating your ability to access your higher order thinking.
I love this. I think this trust and knowing and connection, it does make such a big impact in patient compliance, patient desire to improve their own health, their ability to understand what you're trying to do to help them, if that's the type of help that they want. You're right, you've nailed it. I think that there are those conversations within medicine where the patient is not trusting the physician. Or, in fact, within my family medicine career, I've sometimes said to the patient, I want you to go and see so-and-so. They're a fantastic surgeon. And I'm asking them to do the mechanical work of surgery. And I'm happy to have a conversation with you when you've seen them to help you understand what they're trying to achieve. Because I know when they see the person, they may not get that level of trust or knowing or understanding. But I know that that surgeon will be the right surgeon for this condition for them. But they may need this other assistance towards knowing or understanding to be able to trust. If that makes sense.
Yeah, and we all come from different cultures, if only from different families, but also from different countries.
Yes.
And so there are assumptions that go with it. And so physicians in particular have to cross many different long bridges through their day with all these different people. And let's not forget, for a doctor to trust parts of themselves that aren't what they learned in medical school. What does that thing that I'm feeling in my belly mean? That's different from what happens when when there's some sensation in my throat. This is not a sore throat. This is not an ulcer in my stomach. This is an emotion. There is some energy inside of me that's moving, and it's trying to give a message, and it comes out as a feeling. Now, if you don't have the vocabulary to identify what that emotion is, you can misinterpret, and then you go down a completely wrong route. So we're hardwired. Like, you and I are looking at each other's eyes and trying to make sense of each other right now. We're a little bit handicapped because Zoom has got this micro lag. So our mirror neurons are having to work even harder to track with each other. And you and I have been trained to do it.
Mm. Yeah. Yeah.
But
And you're right, the knowing of our feelings when we do work, when we're learning as physicians, we're often taught to push down our human response, to put it away. It has no context here. You've got to move from one room to the next room and push aside some of that human physiology, some of that feeling, some of that tiredness, hunger, agitation, sadness from the last encounter, and come in with your professional poker face.
well, and so that is something that I'd like to share with physicians. And I'm going to do it right now because I might not get to speak to whoever's listening. Is okay, you go from one place to the next. There is a way for you to down regulate the painful emotions that aren't going to help you in the next room, and upregulate to that part of your brain where you are thriving and creative and you can have access to your knowledge. And I'm going to say that is to get back physically into your body. Feel your feet, touch the ground, your toes, your fingers, your breath, whatever it is, get super aware of your physicality. As soon as you do that, as often as you can do that, as more deeply as you can do that, it then allows your mind to rest. It's like it's got, oh, I have a strong foundation. And you're not thinking about this and that. And did those reports go out? And am I hungry? And did my child do this? And blah, 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 blah. You can rest a bit. And then you are more present for your next patient. At the same time, and I don't think it's an either or, that pain that you saw and witnessed in the room before, if it is not in some way acknowledged between you and the patient and you and yourself, and then released, it stays. It just keeps boiling. And I think this is one of the many reasons that doctors are under so much stress and burnout, because we are still beings, we are still animals, and those bodily functions continue. We just need to be more sophisticated in honoring ourselves and not saying, well, I'm just going to jettison the most powerful part of me for the sake of walking around with just a left brain and just using anything below my neck as a locomotive.
So helpful, right? So important that we remember that we are human and that we have to acknowledge the things that we are going through in our day. And it's not, you're not asking us for an hour between patients to reset. You've given us a very quick way to down-regulate some of that emotional load that's happening within the day.
And your work, you in particular, your work is to help your clients create the systems or the structures to make them more effective. So they're not walking from room to room thinking about all of these extraneous things, or which then prevents them from either getting present or maybe writing their notes most clearly in the few seconds they have, because their mind is like a monkey all over the place.
Yeah. And it becomes more of a monkey by afternoon when we're tired.
Yeah. Yeah. Absolutely. Yeah.
Of all the things we've already done today. Part of that overwhelm or overload.
Yeah. And our what's the word? Our willpower has been exhausted because we haven't kept on replenishing it through the day, and we've overused it.
Yeah. And we'll use it up on anyone else but ourselves.
Yes. Yeah. Yeah. Yeah.
Just because of how we've learned to put others first always. It's part of the, I guess, the initiation, the expectation, the professionalism is you're always giving to others. I think this is part of the self-sabotage as well.
Well, yes. I mean, it starts off as a gift, and it's over-indexed, it's overused. So I use this metaphor all the time in so many conversations for so many situations. It's like we're rowing this boat and we need two oars. And if you use only one, you eventually just go in circles. So yes, I do want you as a physician, when you come and see, when I see you, I want you full on for me and no one else. But long term, you're not going to be a great physician to me. You're not going to be a great physician to society if you haven't learned the skills of caring for yourself. And caring for yourself is more than just yourself. There's your family.
Mm.
Sacrificing your marriage or your parenting for patients is an expensive. It's expensive, risky agreement. That when I look at the stats of burnout, physicians exiting their practice, their suicide rate, I said, this is horrendously expensive for society. But no. There is a better way.
Yeah. And so that can be partly what you're saying, partly the skill sets of looking at what is part of your self-sabotage, automated responses that have got you here, but won't necessarily get you there, that are getting in the way of other things like your team building and your relationships and your productivity, that sort of thing. Whatever you're wanting to work on, there's going to be other things about you that are going to get in the way there, get in that messy middle.
Yeah. That mucky middle. Yeah, I mean, this is where I spend my life. I've got a sort of lunch and learn. It's entitled Mucky Middle, because this is where the real conversations are not happening. And how do we get out?
Yeah. And where do people find you if they're interested in learning more or working with you?
So probably the easiest place, if you're on LinkedIn, is just to go to LinkedIn, Angela Nesbitt. And just type out my name, Angela Nesbitt, and LinkedIn seems to know me. I have a website, angelanesbitt.com. It needs to be revamped. And on LinkedIn, there are my contact details, and it's probably, do you put it in the show notes as well or not?
We'll put that in the show
notes. You'll find it. Yeah.
Perfect.
Yeah. But just reach out. I would love to have just a virtual cup of coffee. And
is there anything we didn't talk about that you think that would be important for someone who is looking at creating change within their environment to create or work towards a goal or create something that's a bit more sustainable within the place that they're in right now? Is there anything we didn't talk about that you think would be a handy place to start or tool to think about?
I think we covered it. Just to summarize, that my work is to help individuals and teams be able to navigate uncertainty and unpredictability, and that has a lot to do with being able to be connected to themselves, to amplify their impact, which has a lot to do with their ability to connect with others through trusting conversations, and their ability to be in alignment with their work, their medical practice, their hospital. And that again is a certain level of connection. And if nothing else, just keep coming back to being aware of the physicality of your body. That will allow your mind to work so much better.
Nice. Thank you. Thanks so much for coming today, and thanks for helping us understand some of the things that could be affecting our ability to make changes.
My pleasure. Thank you for considering talking with me. Thank you.
Perfect. Have a great week, everybody. I'll see you next time. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.